Good morning, everyone. Thank you so much for coming. I want to give you a warm welcome to our Senior Year Alliance General Meeting. We're tickled that you were able to step away from the chaos today and come and get some good information. First, I want to thank the church. Thank you so much for letting us use this place. It's a beautiful place and just welcoming us with warm arms. We really do appreciate it. I also want to go ahead and thank Cynthia. She's with Brookville Assisted Living, where she is sponsoring the meal today and the location. And just once again, we want to give a big thank you to her, so we give her a round of applause. We're going to have a speaker today. It's going to be Miss Samantha Green. Before she gets started, I have a few announcements for our members. Just a reminder, with membership dues, we really need to get those in as soon as possible. If anybody has any questions, if you paid for 2026, make sure you get with Miss Louise, which she's back there in that green, fixing her thing. All right. The next topic we need to talk about is 2026 Senior Year Alliance Conference. Every year, 2 days out of the year, we have a conference which we help give out education CEUs. Otherwise, that's for people that's in the medical field to kind of continue their licensure. Otherwise, it's just free information for anybody in the community, 55 and up, or if you're a caregiver, it's free to them. In that 2-day conference, we want to make sure people get signed up for it to, one, get a vendor table. And we have packets up here that has all the information in it if anybody wants to have a vendor table. The first page also talks about membership, if you were wondering. With the conference, it does break down the sponsorship for that. We will have some amazing speakers this year. We'll have 2 full days. I believe is it 12 CEUs, Louise, that we're offering this year? 12. Yes. 12 CEUs, which is awesome. And if we can go ahead and give Louise a big round of applause for that, because she's been working extremely hard and the conference for it. All right, the next thing that we're going to talk about real quick is directories. We have a mission of going out to the community and talk to senior centers, and our mission is to give free education, help people where they're at, and just network between us to truly help and take care of these patients. And one of the things that we do is that we give everybody a directory, and it's basically what the word is directory. It talks about every level of care possible. It also talks about anybody that's a member, what kind of services they have to offer. So it's like a book they can put on their nightstand or their bedside table where they can open it and look at it, and if there's any care or any questions they have, they can flip to the page, open it up, and find the level of care. For example, insurance agencies, home health, assisted livings, maybe some people in elder law, anything of that aspect. We try to make sure we have it written on paper so these seniors can call someone and not just talk to an AI on the phone, or just truly talk to somebody that's here in our community so we can support each other. The next point that we need to cover is make sure on those directories as well. In this packet, on the very back page, there is an option to buy an ad, to purchase an ad for those books. Every member will be in that book, but if you want a special ad in that book, you can definitely review that in that packet, and also you need to get it as soon as possible as well. Louise, if you have questions about any of it, she can help you. But that's a way that we can raise funds to be able to help seniors by selling these ads in the directory, and also the proceeds from the Senior Care Alliance is how we help seniors for the conference. Next topic we're going to talk about is Speak Connections. We went to Coca-Cola yesterday. There was 40 to 45 seniors there, which was great. We were able to give them free education, free handouts on all the material that you guys gave us. Jay gave a great talk about traumatic brain injury. We were able to bless them with some sweet treats, and we had some good fellowship and was able to talk. Our next Speak Connection will be April 14th at 10:30 at Lavaca Senior Center, and anybody's welcome to come to that. Sarah Floyd will be talking, and she's going to be talking about some activities that we can do outdoors to be services that Homestead has to offer. The next meeting we will have is going to be on April 22nd at Legacy Heights here in Van Buren. Jill Thompson will be our speaker, and she's with the Alzheimer's Association, and her topic is to protect great health. Another important thing that we need to talk about that's coming up quickly is Senior Appreciation Day. This is a day that we can truly love on our community and give back. It's basically a free day for seniors to come, enjoy their time, nothing but free items that are available, which would be lunch, all-day bingo, door prizes, and then, of course, dinner tables. Members that want to set up at Senior Appreciation Day to reserve your slot, you need to email Louise as soon as you leave today to hold those tables. Set by our codes, we can only have so many tables, so make sure you get your email sent over to the Senior Care Alliance email to hold that. And we ask that you bring 10 small door prizes for bingos. Small door prizes, nothing too fancy, of course, but if you have questions about that, we can help you. That's going to be on May 19th at 10 a.m. to 2 p.m. And that's going to be location at the riverfront in Fort Smith. And a shout out to Fort Smith Utility for donating that to us. One more topic we need to talk about is Seasons of Life. And every year we try to put together, kind of formally known as a health fair kind of setting, to where we can get out in the community and truly help people. Seasons of Life this year will be on April 18th, 2026. That is a Saturday. I know Saturdays are hard for some of us that have small children, but they're definitely welcome. I hear small children actually make it funner. So it's from 9:30 to 11:30, and it's community-wide, so it's open to anybody. It's going to be in Paris. It's going to be at the First Christian Church of Paris. If anybody wants to set up at that event, once again, spots are limited, please email Louise at the Senior Care Alliance info email as soon as possible to reserve your spot. Also, for that Seasons of Life, they are requesting for a $25 door prize to basically save you a table, and just to thank them for their time. And with all the business part stuff done, we're going to get to our speaker, which is Samantha Green. And she's with Visiting Angels, and she's going to talk about Medicare Guide Program. There you go.
Thank you so much. I think my voice is going to carry past the mic. I'm a loudspeaker. So I'm Samantha Green. I'm the Operations Director for Visiting Angels. I cover Northwest Arkansas and River Valley. And today we're going to talk about something that is new to the community. Is it new to CMS? No, this is a program that they've been trying to launch for quite some time. But it is called the Medicare Guide Program. What GUIDE stands for is Guiding an Improved Dementia Experience. And I don't have a man of white, so please just work with me on this. So, about Visiting Angels, we specialize in delivering compassionate, personalized care that enriches the lives of aging adults and helps them thrive in the comfort of their home while living a safe and comfortable environment. Our promise is we are devoted to improve the quality of life in seniors with dementia while supporting their families and caregivers. Personalized dementia care is different for everybody. It's not the same. Caregiver support is something that we lack in our community. And there are respite services with dementia. This is something that I'm kind of really going to deep dive into today. It's a lot of information, so please raise your hand, ask questions while we're doing this live. So what is GUIDE? GUIDE is a model that CMS has come up with. It supports seniors with dementia or Alzheimer's of some sort. For caregivers, for compassionate care, coordination, traditional Medicare A and B, red, white, and blue card, they qualify for dementia if they have a diagnosis of some sort. Now, let me kind of elaborate a little bit. There's different forms of dementia. A lot of physicians don't like to specifically say Alzheimer's or dementia, so they will put something in their notes of like cognitive impairment. Those things qualify as well. So why did CMS roll this out? That's the question that I think I hear the most in the home setting. Well, it's the impact that it is putting on our healthcare system for patients who have an Alzheimer's or dementia diagnosis. What we are seeing is the rising dementia population. Our seniors, most of them, show of hands, how many of you either work or have a loved one with a diagnosis? So a good part of you in the room. Seeing higher hospitalizations, more frequent ER visits, caregiver burnout. Families are getting to the point where they're just like, hey, I don't know what to do anymore. I've exhausted all my options. Here we are. What do I need to do? And that's where it's really affecting our community. So our system is overwhelmed, and our families are paying the price of that. So I kind of went down a rabbit hole. I think all of us do that from time to time. But when you start to really look at the statistics for just Arkansas, you can get a little depressed, simply because 11% of the state's population has or has already had an Alzheimer's or dementia diagnosis. Guys, that's 58,000 people in Arkansas today. There are only 60 board-certified geriatricians in the state of Arkansas. For the whole state, just 60. The average paid caregiver cost for just basic non-medical, it ranges from $19 to $30 an hour. If your loved one has dementia or Alzheimer's and they have behaviors, or there's other things like a chronic illness, Parkinson's, things like that go into it, some companies are charging $34 an hour and not more. So if our population has not planned appropriately, we're not seeing the care that they need to be getting in the home. So what that is we have 5.4 billion of unpaid caregivers just in the state of Arkansas. Our hospital admission rate right now, as of 2018, is 21.2%. That's a very large number. They're trying to get it down under, they try 15%, but the goal is 10. Medicaid costs. We're at $492 million a year. There's a lot of families that can't afford the cost to pay for a private caregiver to be in the home. So why do I give you all these numbers? Because this is how God can help. So what CMS did is they said, okay, so here's what we're going to do. We're going to create this awesome program and we're going to roll it out. So what it offers is there's medication management, there's ongoing coordination of care with primary care physicians and other specialists. There's, we're seeing a reduction in ER visits and hospitalizations because with having a caregiver in the home, they're able to say, hey, Sally, Sue, I noticed this today. Maybe we need to get in touch with the nurse, or do we need to call the social worker? Do they have the appropriate equipment? Are we starting a UTI due to dehydration? Those kinds of things. It's also reducing the likelihood of long-term care placement. We're able to age in place. We're offering personalized care plans. This is one thing that Devin, who's my nurse with Visiting Angels, she's present with me today, and I strongly believe in is my plan of care is not going to look like Devin's plan of care, and it's also not going to look like your plan of care. What do today is not the same as tomorrow, and it's not going to be the same 2 weeks from now. We have to be able to adapt in the moment. The other thing that it's offering is assessments, evaluations to manage the disease progress. Like, how are they? Where can we meet them at today? What it's doing for the caregiver. This, I probably should have told y'all this, a caregiver is a family member, a child, someone who's living in the home that's helping take care of this person with Alzheimer's or dementia. It's giving them the education and support services that they need. One thing that absolutely breaks my heart is when I go into a home and it's the lack of what that individual doesn't know is available to them in the community. And it's you have to kind of triage when you're there and make quick decisions of, okay, how can we get you immediate help now? Do you have the right medical equipment? What are the safety barriers in the home? Do we have adequate food and nutrition? There's multiple things that go into that. We're also able to help connect that family member with a support group. Most of them don't even know that they exist. And just being able to go 1 day a week, once a month, to sit and say, hey, this is kind of what's going on with my husband. Talking about it, other people in the room that are in that support group can be like, oh, well, have you tried this? Have you, thought about this idea? And so it helps them kind of think outside the box and know that they're not alone, because it can be a very, very scary time. They get 24 access to specialized dementia care for the team that CMS has worked with. They also offer end-of-life planning, which that is another thing when we go into the home. A lot of people haven't done that. They don't have a power of attorney. They haven't picked out a funeral home. Another thing that we see a lot of in the home is they don't have working smoke detectors. So there's some things that, we help them with in the home. We also get to identify some social needs and put some goals in place. This is something that a lot of the Pocket RN, Continuum, the Vesper Medical Group are working on to get social. What are the social needs that they need in the home? How can we build that social need into the plan of care? And then, referrals to community resources. Help them out. So, God has designed a plan, but who's in the home making it happen? And that's where we make it work at home. So, this is something I'm a little passionate about. So, what God has done is they said, okay, you're going to get, it's $2,563 that they have given to each Medicare recipient. Of that money, they have said this is what CMS is going to reimburse for services. Guide has to be taken in 4-hour increments, and it's totaling to about 18 to 19 visits. However, if you don't use your benefit, you lose it, because once it rolls over, when the new calendar year rolls over, they don't allow your bucket of money to follow you. So if you don't use it, you lose that money for the previous year. So what we tell recipients who are interested in Guide is, okay, see, this is new for CMS. You can use all of your visits at once. So we can do 24/7 care in the home, or we can do a visit once a month. So you can go to that support group. We can do it once a week, but it has to be taken in 4-hour increments. Once you've used up all the visits, that's it. But good news is, July 1st of every year, the new calendar starts. So they get their 19 visits again. Do y'all have any questions? Y'all are a real quiet group today. I think everybody's like on spring break. So let's talk about pre-qualifying for Guide. So, somebody calls and is interested in Guide, the first thing we have to do is, number one, we pre-qualify them through Medicare. So we just need like name, date of birth, Medicare number, social security number, whichever one. As long as their Medicare A and B is active, then we can move on to the next step. Visiting Angels is partnered with Vesper Group, who is a national provider for CMS. And what they do is their social worker and their APN schedule a phone call with the caregiver, the family member that's in the home with the individual. There's a series of assessments, questions that they gather. We will require a letter from the primary care physician stating that that individual has, in fact, either a cognitive impairment or Alzheimer's or dementia. And then once we do that, they submit all that information to CMS to Medicare. Medicare then comes back and says, hey, you qualify for the program. Now we're on to the next step. Next step is sending an RN, minor 7 would go for me, into the home to do a home safety assessment. That home safety assessment, there are some questions on there that really make you go, oh, I would have never thought of this to be asking in the home. One of those is, are they leaving the stove on? Are they leaving exit seeking the home? Do you have alarms on doors, windows, you name it? Keys taken up, knives, anything of that can harm them or someone else in the home. So we do this home safety assessment, we turn it in, and then usually, what would you say? Day, maybe 8 hours, we get an approval. Once we get that approval, then we can just call that individual's family member, and we start seeing visits in the home. Families can stay in the home, they can leave, it's however they want to do it with the guided visits. Again, it's person-centered care. Do y'all have any questions about that? Yes, ma'am.
Okay, I have a question. So is Guide nationwide or just for Arkansas?
It's nationwide. It can be used in any state in the U.S.
What does Guide stands for?
Guiding, I have that in my very first slide. Guiding an improved dementia experience. Do you guys have any other questions about Guide? Again, y'all are a very quiet crowd today. I have seen y'all really act up on that FaceTime. Okay, so let's move on from Guide. Helper bees, has anybody heard of helper bees in the room? Oh, okay. So a lot of individuals have a Medicare Advantage plan. There's a program called Helper Bee, and it's BEE. And what it is the Medicare Advantage plans have realized, oh, hey, like we have individuals that need home care services. So they are allowing, again, they get to control the hours, how long the authorization is, the providers do not. So I just want to make sure that I let y'all know that. They are allowing recipients who have a Medicare Advantage plan to enroll in the Helper Bee program and be able to utilize non-medical home care services. It can work along with home health. It does not work if someone is on hospice. So the providers, the United Healthcare, Aetna, Humana, all those, they set how many hours the recipient receives and how long the authorization is. Those are usually about 2-hour visits, but they are available. Again, a lot of the recipients who have a Medicare Advantage plan do not know that that's even an option for them. So if you're talking with some and they're like, I don't know what that program is, there is an 800 number on the back of their card that they can call and speak with a customer rep, and they should be able to tell them if they're enrolled in that program or not. And then if they're not, help them and walk them through how to get into that program. Do y'all have any other questions about that?
So they call the number and then they ask about it. So when you say help them, whoever's on the line for the
Yes.
insurance should help them with that.
Yep, the customer rep helps
And
them.
don't know if they're enrolled unless they call and check.
Correct. So the only thing is, as a provider, I can't help the recipient enroll in that. But like a social worker could, family member could, they don't let the provider do that.
Gotcha. Is that accepted with all home care, or is that just specifically for y'all's company?
So I think there's 2 other home care companies in River Valley that are in the LRB program. So.
And you guys are Arkansas and Oklahoma, or just Arkansas?
So I go nationwide, however, I just service Northwest Arkansas and River Valley. Yes, ma'am. Well, thank you all for having me. That's pretty much it. I think I finished in record time.
Alright, I know I mentioned a lot of dates earlier, so if there's any dates that you guys need us to recall, we can. I want to thank Samantha so much. That was great information, and thanks for your time for that. The meal was delicious. I don't know about y'all, but I'm full. That was great. I think we're going to take this time to slowly start introducing all the members that want to come forward and introduce themselves. I'll start, right? Ashley Brazier. I'm the Vice President for Senior Care Alliance. I also have a day job, and that's at Mercy Rehab. I'm your clinical liaison, so if anybody is falling and rehab home went from being completely independent, and now they're declining quite a bit and not able to walk on their own, it just takes one phone call to me, and I can start assisting. You don't have to go through a primary care. You don't have to have an order for inpatient rehab. It just takes a phone call to me. I have business cards, and my phone number is 479-957-1700. Does anybody want to go next? I also have a new boss in the room, announcement for sure. Jessica Taylor, she's going to be my new business development director. We're having some ideas on the go, so we're going to have Jessica in that role. But anybody else want to introduce themselves? Come forward now. We do 3 hours a day of rehab, 2 weeks of stay.
Hello, I'm working with Heart Hospice. We do palliative hospice care in our area. I just want to remind people too that you don't have to wait on your PCP to get services started. If you have a loved one struggling at home and just don't want to make it out to see anyone, don't have to wait in the ER either. Just give us a call and we can get a nurse out there to do an assessment. My number is 479-462-7932. The next one is.
Thank you. I am Shannon Johnson. I'm with UAMS. I'm the new Assistant Director there of Education. We offer a variety of programs, Drums Alive, Tai Chi, different programs throughout the community. So if you have any questions, you can reach out to us. My email is Shannon Johnson. It's 2 A's in Shannon, there's no O, at uams.edu. I also have my phone number, which is 479-478-8635, I think. So, thank you all for having us today.
Good afternoon, everyone. I'm Teresa from Legacy Heights, just down the road. It's an independent retirement facility, and when you get tired of maintaining your home, you come see us and we'll spoil you. We do your laundry, we do your cooking, and we do your housekeeping. And then we also have assisted living, and then we have assisted living memory care, like she was talking about earlier. And also we do have a support group for the dementia patients or just local community in the area that would like to come to our support group. You don't have to be a resident or anything in our facility, but it's a great program. Louise has it, and it's on the first Tuesday of every month at 5 o'clock. So if anybody in the area, I seen some hands raised. If you want to come and join the support group, that would be awesome. My number is 479-262-6466. Thank you.
Good afternoon, everybody. My name is Charlene Footen. I'm the Director of Development for Brookfield, Effiona Oaks, Bella Vista, and Hot Springs. And we got a fundraiser I know everybody likes brisket, so this is an opportunity to get a brisket lunch. It's going on all day Friday. You can go over, you can call this number, and I'll leave some flyers. And it goes to the Make-A-Wish Foundation. So $15, you get lunch, and you're also helping a very worthwhile cause. If you have any questions about it, like I said, I'll put some of these on the table. We are an assisted facility here, and I'm sure you guys probably know more about the building than I do because I'm new in the Fort Smith area, but not new to senior care. We do independent assisted at Fiona, at Bella Vista. We have independent assisted at memory care. And then I'm from Hot Springs, and so we have independent assisted and memory care there as well. Thank you.
Good afternoon, everybody. Can you hear me? Is this on? My name is Katrina Colquitt, and I work for WellQuest Riverback Valley PACE. PACE is a new program in our county. There's several counties that PACE is going to be supporting. PACE is not a new program. PACE is kind of similar to the GUIDE program. PACE stands for a program all-inclusive care for the elderly. So PACE is a center you can go to for all of your healthcare needs. So if that's medications, if that's therapy, if that is specialty doctors, everything you could possibly need from A to Z, PACE is there to help you with those things. We have a IBT team there that will work on your plan of care. Each individual, of course, has a individualized plan of care. If that person is working with Home Health Now, we will partner with those folks and also moving forward work with those people as we're getting PACE out into the public. A lot of people do not know about PACE, so I'm outreach just trying to get the information out there about the PACE program. We're opening the center April 1st. We're taking referrals. I have some rec cards that has a lot of information on what helps you qualify for the PACE program, what the PACE program is all about. It is a great program for our county. There's several counties, Franklin, Logan, Sebastian, Crawford, Johnson, and Scott, we will support. Transportation is involved. We're included. We will pick you up if you need transportation. This program is really, in my opinion, a bridge for people who there's nowhere for them to go, and a lot of times they end up in the nursing home. So this program will help keep you at home and not in the nursing home for just a little bit longer, and I think we all can appreciate that we want to stay home as long as possible. So I have some of these. I'll leave them on the back table if you want to pick those up. Has some additional information. Thank you.
Hi everybody, I'm Amy Kirkendall, Recreation Therapist and Memory Care Program Coordinator at Brookdale Senior Living. We are an assisted living community right in the heart of Fort Smith by Central Mall. We have assisted living, and we also have our Alzheimer's and dementia community that's a secure community as well. We offer several different activities, not only daily but weekly. We do some really amazing outings. I enjoy doing that part. And we have monthly family nights, and I also do a monthly education group. I have a different dementia topic at it's the first Thursday of each month at 4 o'clock. So anybody's welcome to come to that, and each month I do a different topic that has to do with dementia care or just learning about the different types of dementias and different ways that you can help your loved one. If you have any questions, give me a call at 479-484-5556.
Hey Nancy, what is Brookdale Fort Smith doing for Easter this year?
Okay, we have an Easter event coming up too. That's my boss, Cynthia. We're going to have a really just kind of a nice little Easter gathering. We do like our family nights. We just had our bingo night last month and raising money for the Alzheimer's Association. So April 4th on Saturday, we are going to have the party goats coming out. They've got a bunch of baby goats and mama goats coming out. Then we're going to have a little petting area, donuts and juice, and then also Easter bunny pictures. So you can bring kids, grandkids, great-grands.
It's a lot of fun, but it's 9:30 to 11:30 on April 4th. And again, our numbers, 479-484-5556. Thank you.
I don't know if I can follow that. I'm Cindy Taylor from Mercy Crest Assisted Living. We have a 102-bed facility across the river in Florida. We have independent assisted living and memory care as well, and we do have a memory care program and support group at our facility also. Thank you.
If anybody has any questions, definitely please feel free to hang back and talk to these community members that just want to help you. And thank you for once again giving us this location today. Remember that our next meeting will be April 22nd at Legacy Heights here in Van Buren. Our next Sweet Connection is going to be April 14th at Lagaga at 10:30, and all is welcome. Y'all have an awesome week, and remember, get those dues in for membership, get your sponsorships in, and get those table reserves for the Senior Appreciation Day and for the conference and Seasons of Life. There's a lot there.